Let's talk about the basics of blood sugar today. The global burden of diabetes is on the rise. It's expected that 578 million people would be living with diabetes by 2030 and 700 million people by 2045. In India alone, there are 77 million people living with diabetes. 50% of them don't even know that they have diabetes. That is, 1 in 2 people have undiagnosed diabetes. 50 to 65% of people in the age group of 20 years already have high risk factors for developing diabetes in their lifetime. New onset of diabetes is seen in patients with COVID-19 infections as well. Every single cell in the body needs glucose for energy. Excess of blood glucose results in diabetes. Insulin is the hormone which is released from the beta cells of our pancreas. Insulin pushes the blood glucose into the cells for consumption. What are the types of diabetes? Type 1, where there is beta cell dysfunction and insulin deficiency, commonly seen in children. Type 2, seen in adults and patients who are obese, where there is peripheral resistance of insulin. And the other type of diabetes is gestational diabetes, which is a temporary form that resolves after delivery. The commonest type of diabetes we encounter on a day-to-day basis is type 2 diabetes. Risk factors for developing type 2 diabetes is age above 21 years, being overweight or obese, increased waist circumference, lack of physical activity, and if there is a family history of diabetes. How to check blood sugar at home? By using a glucometer or a blood glucose monitor. By simply pricking the tip of your finger, this measures the capillary blood glucose instantly. And continuous glucose monitoring, called as CGM, where there is a sensor inserted under the skin that picks up the blood glucose levels from time to time. Checking your blood glucose levels after an overnight fast of 8 to 12 hours. If this value is more than 126 milligrams per deciliter, postprandial blood glucose, that is 2 hours after your breakfast, if the value is more than 200 milligrams per deciliter, random blood glucose checked any time on the day is more than 200 milligrams of deciliter, implies that you have diabetes. The confirmatory test for diabetes is HbA1c or glycosylated hemoglobin. If this is more than 6.5%, you know you have diabetes. What is HbA1c test? Hemoglobin is a protein that is present in red blood cells and carries oxygen. Glycosylated hemoglobin is the percentage of hemoglobin that is coated with blood sugar. HbA1c gives us the average blood glucose in the last 3 months. Higher the level, poorer is the control. Why is it important to treat diabetes? It is because high blood glucose levels can damage a lot of our internal organs. Complications of diabetes are classified as acute and chronic. Acute complications are diabetic ketoacidosis, hyperglycemic hyperosmolar state, and hypoglycemia or low sugar. The chronic complications of diabetes can be macrovascular or microvascular. The macrovascular ones are cardiovascular disease like heart attack and stroke and peripheral arterial disease. The microvascular complications are diabetic eye disease, diabetic kidney disease, diabetic nerve disease. And diabetics are prone to various types of infections. We shall discuss the complications of diabetes in our subsequent videos.
Altius Hospitals, a place safer than home.